Neli alikuwa ni mtoto mchangamfu, walikuwa anacheza na wenzake, akaanza kutembea taratibu, kawa naenda hivyo hivyo, lakini baadaye ilipofika mbeleni, baada ya siku nikaangalia mwanangu tumbo limejaa. Nimezunguka, nikaenda hospitali ya huku na huku, wakawa bado hawajagundua ugonjwa wao. Ndio nikawa naingia chumbani, nikawa naeleza nilivyokuwa na mtoto, tayari akawa ameshanipokea.
Nutrition is really important in pediatric cancer care because the disease very frequently is going to affect the microbiome of patients, and then the treatment is likely to wreak havoc further on the gut health of patients. IPAN is uniquely positioned to test new and exciting nutritional treatments and at the same time treat underrepresented populations from low and middle income countries.
Through our global network of 33 centers in 17 countries, IPAN offers a low-cost, high-impact model that works collaboratively with local governments, hospitals, clinicians, and staff in host countries. We are building upon the wonderful work of organizations like UNICEF and WHO as we focus on nutrition-based wellness for families and communities.
Most of our children come with nutritional problems. We have one nutritionist who is dealing with more than maybe 500 children. So that's a very big task.
We had a very tiny nutrition program, but it really wasn't fit for purpose in that we had no nutrition input, with no expert nutrition input. But then we met Elena, and she looked at our interventions, and she was able to really change them so that they would have maximum impact on the children. She also trained our staff to be way more effective in their jobs.
In resource-stricken countries like Tanzania, Uganda, and other IPAN centers around the globe, our educational expertise is really based upon working side by side with local clinicians in order to utilize local foods, local markets, in order to improve the overall nutritional care delivered to children.
IPAN has offered trainings to me, the only nutritionist at the Uganda Cancer Institute. And with this knowledge, I am currently able to make proper assessment of children for malnutrition and then take appropriate action depending on their nutrition status.
Good nutrition is equivalent to eating the rainbow. You need a selection of nutrients, including seeds and nuts, fat, high protein, and high fiber foods.
Tunatumia viungo vya ndani vibichi kama vile nazi na embe mbichi. Pia tunatumia mbegu kama vile karanga na matunda kuziongeza kwenye uji au kutengeneza michuzi yenye protini nyingi.
We started with a simple smoothie for the children. And it doesn't cost very much, and it isn't very difficult. We need a small kitchen, we need people to be educated, and we need access to normal food products that are available in any market around the world.
Smoothies hizi huwapa vitamini na virutubisho vingi na kusaidia kulisha miili yao.
When a child can get good nutrition, then you see the way they grow, you see the way they can interact with the environment. So good nutrition is actually everything.
Smoothies zetu zilifanikiwa sana hivi kwamba pia tulitengeneza mipira ya protein ili watoto walio na uvimbe mkubwa kwenye matumbo yao ambao hawawezi kula bado waweze kupata lishe nyingi iwezekanavyo kwa kiwango kifupi cha chakula.
Kiukweli mzazi anapokuja na mtoto wake kumleta, kwanza mzazi anakuwa amekata tamaa, hana imani kama mwanaye ataweza kupona. Baada ya kuanza kutumia virutubisho hivi tunavyotengeneza, mabadiliko yanakuja kwa mtoto, anaendelea vizuri na afya yake inaimarika, na mzazi anakuwa na furaha, anakuwa na matumaini makubwa kwamba mtoto wake atapona.
Neli alipewa lishe ambayo kuna maziwa ambayo dada Ana walikuwa wanamhudumia mwanangu, ile ikafanyika kama dawa kwa mwanangu. Nikaona mwanangu anaimarika na kaa vizuri. Safi, tajisikia amani. Aya, ongea wasikie sasa.
Kuwa nesi.
We have seen the changes that it has made to the children's lives. Children can tolerate their treatment much better and they are surviving their cancer. So this modest input has an enormous impact over the lifetime of the child and the family.
By studying the interplay of poverty, food insecurity, and nutritional health on things such as gut health and the immune system, we can begin to better understand their effects on cancer and side effects associated with treatment. It's not just about the right here, right now. We want to be able to educate patients and staff for the longer term, so that what we do provides a sustainable solution that can be applied for many patients for many years to come.
We not only are observing impacts on the children with life-threatening conditions, but also IPEN is impacting the surrounding communities, teaching kids about diverse and healthy foods in order to support optimal growth. The impact of IPEN in Tanzania and surrounding countries supports the healthy growth and development of children irrespective of where they live, irrespective of their socioeconomic circumstances, and irrespective of the resources their family has to healthy, nutritious food. IPEN is doing nothing short of leading a global science-based revolution by providing high-quality, low-cost nutritional care to children all over the globe. Your generosity